share with you that autism just basically means it's a developmental disability that significantly affects the verbal and the nonverbal communication and social interaction. Generally, it's evident before age 3, but other characteristics are often associated with autism. That means it has like engaging in repetitive activities. It also has unusual responses to sensory experiences. But look, let me tell you a little bit about Rett syndrome. For this particular disorder, as it is classified as a progressively neurological disorder, surprisingly, it strikes all ethnic groups and occurs worldwide, 1 in every 10,000 female births. And although Rett syndrome can affect males, the incidence in males is not known. For this particular specific learning disorder, the symptoms of disorder are easily confused with those of cerebral palsy. The clinical diagnosis specifies a small head, small hands and feet, stereotypical repetitive hand movements such as mouthing and wringing of the hands, also included as diagnostic signs. For Rett syndrome, the symptoms of this disease include learning disorders and a total inability to socialize. Girls with Rett syndrome are prone to seizures and gastrointestinal disorders. They typically have no verbal skills, and about 50% of them are females. As we know that the Rett syndrome is linked to the X chromosome, the development is normal until about 6 to 18 months. And then when language and motor milestones regress, that's when the hand use is lost. And you could see signs of characteristics of autistic behaviors. So over time, children with Rett syndrome have increasing problems with use of muscles that control movement, coordination, communication, and it also can cause seizures and intellectual disability. So for a student that has Rett syndrome, we know, as I mentioned before, that they often lose their ability to speak. So in classrooms, teachers should be able to give assistive technology, communication technology, to help the students communicate effectively, because their cognitive ability is rarely affected. Okay, so the intellectual piece can be compromised, but the cognitive ability, you just have to provide modifications for students with Rett syndrome in order to complete classroom assignments. Another thing that you could do for an accommodation for a student who has Rett syndrome is offer them argumentative communication equipment. And that is specific to, again, a device that can give them the ability to respond as well as interact with other learning tasks. Time is definitely something that they'll need in order to complete the task that's at hand. Many students with Rett syndrome use a wheelchair for mobility. And remember, that's because I mentioned before that there's loss of muscle function. And teachers need to make sure that the classroom is set up to accommodate students that have wheelchairs. And also plan to have different modifications set up, such as shortened lessons and assignments due to physical and mental delays. It may take a little longer for these students to complete tasks. Also, students with Rett syndrome struggle with working memory, so they become a little overwhelmed when they're presented with too much information. So the information that the teacher needs to give to the student with Rett syndrome may need to be spread out over the course of a few days. And then the other students, and I guess with the other students, they can do repetitive activities with the students with Rett syndrome, just to include them so they don't feel that they're isolated because they have to do things repetitively. Now, I just want to share with you a little bit more about the ISB definition of Rett syndrome. As I have gone through this, again, I have found every time I put in Rett syndrome, it automatically populates autism. And so when I clicked on the ISB.net site, it defined autism as individuals with disability, according to the Individuals with Disability Act, as a developmental disability significantly affecting verbal and nonverbal communication and social interaction. And it also says that the Illinois definition means that a developmental disability significantly affecting verbal and nonverbal communication and social interaction is generally evident before age 3, where I'm concluding that they both outline that a communication barrier is present and a social interaction barrier is present, but they both also relay stereotyped movements and resistance to environmental change and resistance to daily routine, and changing resistance to too many changes in daily routines, and the idea that there is unusual response to sensory experiences. This is a very challenging topic to discuss. Reason being, it did not offer a lot of information regarding Rett syndrome, primarily because I continued to find information about autism when it came to the ISB website or the IDEA. But I was successful in finding some very good information on the MayoClinic.org website. And here's where I located the overview as well as the symptoms for someone who has Rett syndrome. So as we have already determined, it's a rare genetic neurological and developmental disorder that affects the way the brain develops, causing progressively inability to use muscles for eyes and body movements and speech. And it occurs almost exclusively in girls. It says most babies with Rett syndrome seem to develop normally at first, but after about 6 months of age, they lose skills that they previously had, such as the ability to walk, crawl, communicate, or use their hands. And then that's where we have, over time, the children generally develop loss of coordination, communication ability, and seizures and intellectual disability can occur. Although there's no cure for Rett syndrome, potential treatments are being studied, and they are continuing to focus on providing care and support for children with Rett syndrome and their families. The most pronounced changes generally occur 12 to 18 months of age, and then suddenly over a period of weeks or months after that. Most babies with Rett syndrome seem to grow and behave normally for the first 6 months. But then after that, as we know the symptoms develop, you'll see slowed growth, loss of normal movement and coordination, loss of communication abilities, abnormal hand movements, unusual eye movements, breathing problems, agitation and irritability, other abnormal behaviors, cognitive disabilities, seizures, abnormal curvature of the spine, scoliosis, irregular heartbeat, pain, and other symptoms. As an educator, we would probably have a student in our classroom with Rett syndrome, or Rett syndrome, I'm sorry, not at stage 1, which is the early onset where it starts between 6 to 18 months of age and it can last for a few months or a year. But we'll probably start to have the student in our classroom during the ages of where it's like stage 3. Stage 2 is rapid destruction. And that starts between 1 and 4 years of age, where children lose the ability to perform skills that they previously had. And then they also have slowed head growth, and then that abnormal head movements. They begin to hyperventilate, scream, or cry for no apparent reason. They have problems with movement or coordination and loss of social interaction and communication. But the plateau, which is stage 3, is where the student will be coming into our classrooms early on. So from ages 2 to 10, it can last for many years. It is where the seizures come, and there's a lot of crying and irritability, and some improvement in hand use comes, and communication, but not much. Finally, there's stage 4. That's late motor deterioration. And this stage usually begins at the age 10 and can last for years or decades. It's marked by a reduction of mobility, muscle weakness, joint contractures, and scoliosis. So understanding communication and hand skills generally remain stable or improve slightly, and seizures may occur less often. So that's a positive. The seizures won't come as often after age 10, but this is a hard place for a person with Rett syndrome to be in, because now they're not as mobile as they may have been previously. Things that they could do, they no longer have the ability to do them, meaning their hand movements. So that's where the assistive technology is going to be really important. Finally, I just want you to know that because males have different chromosomes than females, boys who have genetic mutation that causes Rett syndrome are affected in devastating ways. Most of them die before birth or in early infancy. So a very small number of boys have been diagnosed with Rett syndrome because it is so devastating to the boys. I think that is just about everything I want to share on this video. I guess I can sum it up by saying that a student with Rett syndrome will need lifelong care and assistance with activities in daily living. In our classrooms, we need to understand that they may experience anxiety and problem behavior that may compromise social functioning. We need to be prepared that students with Rett syndrome may have a shortened lifespan. They don't live as long as most people because of the heart problems that is associated with the Rett syndrome and other health complications. So as we are preparing our classrooms to include all learners, if we happen to encounter a student that has Rett syndrome, I am almost positive that this small video will assist in us having a better understanding of how to service our student who may experience this specific learning disorder. And know that Rett syndrome causes problems in the brain functioning, and it's responsible for cognitive, sensory, emotional, motor, autonomic function delays, which can include learning, speech, sensory sensations, movement, breathing, cardiac function, and even chewing, swallowing, and digestion problems. So if that is all I have for today. I just